Hey guys, welcome to A Little Help for Our Friends, the podcast for people with loved ones struggling with mental health. Hello, little helpers. We are going back to a topic we talk about a lot, but with a very different lens. And we have a great guest for us today. Her name is Agatha Peters. She is a licensed clinical social worker in Washington and Oregon, trained in CBT, mindfulness, and EMDR. She's got a book called Trapped in Their Script, written for adult children of narcissistic parents. So this is the topic that we are returning to. But um, here's the twist. So this is for especially those from collectivist cultures where family loyalty often overshadows individual well-being. So drawing from her experiences as a Nigerian American psychotherapist, Agatha offers guidance on embracing one's identity while respecting cultural ties. I'm excited for this topic because I have a patient. This is like super relevant for. I'm gonna thank you so much, Agatha, for coming and talking to us about this.
Yeah, it's so nice to be here. I've been listening to your podcast, like I told you guys this morning, and I just love it. Now I'm gonna have to subscribe and continue through it because I just love it so much. So yeah.
Well, I hope so. And Kibby, this is a topic that I feel like would super resonate with Cool of Mind kids. So do you want to talk about how Cool of Mind can help?
Yeah, before we dive into this super interesting conversation, I have so many questions for you, Agatha. But I just want to mention to anyone out there who are struggling with loving someone with narcissistic personality disorder, maybe they're really affected by narcissistic abuse or emotional abuse in their relationship with their partner or their parent or sibling. We're here for you. Check out Kula Mind Community, KULAMIND. In our community, we're teaching skills to really navigate these mental health challenges in our relationships. So we teach setting boundaries, identifying narcissism and narcissistic abuse and the effects on you and your mental health, and how to advocate for yourself. So if you're interested in that, go to our website, kulamind.com, KULAMIND.com, and I'll also put the link in the show notes. But thank you for letting me announce that. But Agatha, can you tell us a little bit of how you got into this topic? Like, tell us a little bit about your background.
Yeah, so I spent 14 years of my life growing up in Nigeria, and transitioning into the US. The first place we landed was Oregon. So, um, very different cultures, huge culture shock. But things were done much differently than in my culture, obviously. And I got into therapy after, my gosh, in college. I remember being around 19 or so, and my professor at that time had said, well, you would have to check your own stuff and your baggage first before you can help others. Well, my culture, people don't really go to therapy, but I thought, well, that sounds interesting. Like, yeah, I would have to, it makes sense to have to do your own work before you try to help others. Um, so when I sat on a couch with a therapist that was non-Black, I am Black, being a Nigerian, and was looking at things from a white lens, definitely, and yeah, having to call out my parents, and it for the first time I felt heard, but I was not ready to at all unpack. I had no idea what therapy was until that point. Um, and she put names on things that I definitely was not ready to address. And it took me a while, and I wondered why. Up until writing really until a few years ago, after when my master's, having sat with plenty of clients, did I actually having my child, I think having my firstborn really made me understand that my parent is um, a narcissist. And I think for a long time, being we're in this profession, like we want to fix things. So for you to tell me, I think that was one of the things, is just not being able, you help people, but you can't help your own parent, like, or you even help yourself go through, like, how it just was really hard. So I knew for me dealing through it, a lot of people, and I also got a lot of clients that were experiencing the same sort of challenges in their different cultures that were primarily collective, where there is my, yeah, my Indian clients, my, Mexican, Asian, name it, like so many different people in this sort of cultures, but we're still obligated to family loyalty. We're so, it's pressed on us. There is community that tells you you have to do things this particular way. And if you fall away from that, you're doing something wrong. So you're the problem. For the longest time, I thought I was the problem. And yeah, that's how I got to writing. So to help
Yeah,
people
that's
through it.
it. So you had experience working with a non-Black therapist, and a lot of times we think of that as sort of essentially problematic in certain ways because, especially like white therapists bring a lot of potential bias. But it
Yeah.
sounds like in some ways this was helpful to you. What was that dynamic like?
I think this was helpful to me. I think she did work that helped me. I think she was helpful to me in a actually addressing my well, not addressing my abuse, but actually acknowledging, maybe, or starting to at least like that, having that blindage that I had on for so long, starting to open my eyes a little bit. um but I, being an immigrant, we're just happy to get help. Like, it did not matter to me kind of what you look like, to be honest. I was happy to get help, whatever help looked like. My insurance covered it then. I had to pay a couple of dollars here and there with copay, and I was so young. So just being in the presence of help. I think we look at things differently. I don't, maybe in that sense of, it might be different for maybe a Black American that does not come from that same background. I hope that makes sense a bit.
Yeah, no, it's just interesting to think about like how how these dynamics can unfold because in some ways I could see how it could be helpful to kind of say like here's, in this culture
Hmm.
that behavior, looks so it's such a contrast that
Hmm.
we can see that contrast more clearly like and maybe
Hmm.
this behavior isn't quite appropriate or compassionate or
Yeah.
whatever. And
Yeah.
at the other set, it might be harder for that therapist then to understand that kind of collectivist culture. So
Absolutely. Yeah, I see what you mean there. Yeah, from in my cultural lens, yeah, I thought, well, you have no idea what I'm going through, right? Like, there
Mhm.
is that complete differences there. Um but my goodness, it felt good to be seen for the first time. Like, woo, what, like, someone even seeing me and seeing the struggle and pain, and it not being so much in my head anymore. I think she used certain languages that were probably triggering to me as a Black individual. Like, that was the hard thing there. But nothing that she did intentionally. And as a therapist, as her being a therapist, I couldn't really call her out because it's that dynamic as well. Um, but I think then versus now, I know what I need from a therapist. And I did try seeing actually another white therapist. I live in Oregon. There's not much options here. Another white therapist last year. Um, and actually doing my writing process. And I just knew I didn't, I was not that same 18, 19-year-old then. And at this point, I've lived in America for so long, and it just brought back a lot of things for me that I couldn't really, it just felt different. It felt very different. So I give it at least 8 sessions, like I would with my all my clients, keep going. Because she was so skilled too. Her expertise was narcissism and an EMDR, which is exactly what I needed. But it was really hard for me, and it also partly why I wrote the book for therapists too, to see how to help their clients through this um, different lenses, because it's just, yeah, it was hard to connect with her in that way. Which I know she's phenomenal and does a wonderful job, but that cultural part was really difficult. Yeah.
What translated cross-culturally between you and your therapist? Like what did your therapist or you identify as like the effects of having, growing up with narcissism? Like what did you notice was like something you were struggling with?
Yeah. So I think for me, the huge thing there was, first, my narc was so bad that there was a lot of suicide for me, like suicidal
Mm.
ideations. We talk about the spectrum from like here all the way. Yep. Just individual was in like this huge part that it affected my mental health a great deal. Where I would, yeah, just really think of ending my life so
Mm.
frequently. So, in so many ways, that first therapist opened my eyes, but it was going through that. So, that opened my, and I think even with this therapist I saw last year, I kept needing validation, which was an odd thing too, because even though I'm in the field, I know all the things. Um, but the culture is that piece of it is your fault constantly, right? Like there is this guilt, there's all these things. I kept needing validation. I would, even my mentor that I've known for over 20 years, and oh, sorry, I've known for um over a decade, and she's been a therapist for 40 years, has even validated me. My gosh, you're not wrong. This person is the worst of worst. Like, but it still wasn't enough. I'm like, you're saying that because you know me.
Mhm.
So yeah, it's the suicidal part. And that was a huge thing, to not know it's just not a depression or something that is causing this, but more so environmental, and the individual that I was with at the time.
Mm.
um yeah, it was not good.
Was the kind of ideation a result of this person? So it sounds like they would behave really poorly and then blame everything on you. And so it was kind of
Yeah,
like a progressive like degradation of your self-esteem and sense
yeah,
of
but
right.
also the community aspect of it. They were so known
Mhm.
in the community. So when you do have a narc who's a parent or a guardian, the mask is on in the communities. They
Mhm.
are the most, like their better word, essentially perfect in these people's, like they show up, they're great. So you want to see that. That also makes you feel like it's your fault. You're doing something wrong. Like, why are they not showing me that much love? Why are they not showing up for me in that way? Why are they, so that constant, and they also tell you it's your fault. So there is that, you don't love me like these strangers. And then, you're also confirming that you get that confirmation at home too, that yeah, this is all you. So there is that constant, and then the communities also, it was almost this coming together, and like, yeah, you do bad things because this pain to your parent, you do, feeding a lot of lies that were not there. But again, they needed that. This person would be described as a vulnerable narcissist. So they needed that. There's still a lot of that sadness and just, kind of thing. And it's poor me. I'm going through this, a lot of that. So then, then you're getting calls, or you're being pulled away in meetings, like, or, in gathering, like, what, why making them cry? Where I was like, I wasn't aware that
Mhm.
they're crying. Like, so yeah, there is a lot of that that just fed that, narc in that way. So much blaming, not just from that person, that individual, but the community, it for a child, it would be like stepping into a school ground knowing you're gonna face your bullies.
Mm.
Right. And this is why again it's so hard within these cultures because we're seen as a group. So, and when your guardian or parent says something about you, it must be true, right? Like that's when you go to the hospital and you take your kid to see a doctor, they ask, "Hey, mom, hey,
Yeah.
dad, what's going?" So it must be true. So that's in so many ways I don't blame them because that's what's set out. That's what they, even though it's complete false, but that's what um they have to believe. Um and then there is also the respect of the elders, all the things that come up and you just yeah.
Yeah, I have this urge to, I'm like trying to figure out how to make this a more bite-sized question because it's really big.
So much,
I
right?
kind of want like a description of Nigerian culture. Like, what was it
Mhm.
like growing up? What is the day-to-day like? Who are all these people that define the
Um,
family group?
I feel like, day to day growing up is just sort of, you have aunties from, which is very common in a lot of those collective cultures. A lot of people are aunties, even though they don't birth you, but, that form of respect. A lot of people are, so again, that community, right? Like if you're my auntie, I can come to you or I can, there's beauty in a lot of that. There is,
Yeah.
you have people that are always there. You're not alone unless you're made to feel, a certain way. But there can be a beauty. It can be beautiful in so many ways. But when it gets problematic is when we have situations like narcissism, and that's yeah. Um, yeah, there, you grow up with cousins, you grow up with, your neighbors, you can just walk in wherever and all that. And I honestly, when growing up in Nigeria, my narc wasn't a problem then. It was in,
Mm.
yeah, it was in the US. Um, I went through other abuse back home, but that was not, yeah. Yeah, not my narc. And I didn't really, grow up with them in that sort of dynamic, like you would think a parent, sort of situation. But um it was the year that it really and then there is this cultural expectations where you have to make it. You have to, you also had the opportunity to come, so how do you feel? So then, which we all strive to do, when you immigrants, you want to do so much, but then that also can be a burden, and even more so when you are dealing with someone that is a narcissist. They can use that and exploit that in so many ways. Yeah. Hmm.
How does narcissism in parents show up differently across cultures? I resonate with a lot of what you're saying, and I don't know the specifics, but and I come from a Chinese culture where it was, like the elders, the parents, you
Hmm.
listen to them no matter what. And I was just having like the other day having a conversation with a family member about a situation where someone who was older um, was like hurtful to the younger person, like said something hurtful.
Hmm.
And the attitude was like, well, they're the older
Right.
ones, like,
Yeah.
it's fine,
Yeah.
just you apologize, right? Like as a younger person, you deal with that. So like even thinking about narcissism and right now in America, like we are talking all over the place about how there are narcissistic parents. But I wonder if it look different if it's in a
Yeah.
different culture where narcissism in parents and older people is like accepted,
It's
right?
so
Like
right, like the
the
hierarchy.
entitlement, like they have entitlement,
Yes.
right? Like
Yes. Just from being a year or two older, I was meant to say auntie. Like this idea of like you're already old.
Right. They are special if they're like older than your parents. So it's
Yeah.
like, is it,
Hmm.
does it look different if it's in a different culture, or is it like the same, but we just don't like it as much here?
Well, I think it does look different. And in my book, I really dive into, well, first of all, is it narcissism? Because there are different mental disorders and, what that looks like. And then second of all, if we're dealing with cultures that really we think about parenting styles, there's authoritarian parents and authoritative. I think between those two, if we think of an authoritarian, which is much more, they're strict, but so, um, this sort of styles, I think, makes a huge difference in these cultures. A lot of us in those cultures are raised by authoritarian households. Like they already set up your path. You're going to be a lawyer. You're going to be a doctor. I was a doctor. You're being a doctor. But why is that true? Where is that coming from? Is it coming from entitlement? Is it coming from, I want you to be better? Is it coming, so this, and if you do not meet those expectations, are you still loved?
Mhm.
Right? Are you still cared for? And when I do look at these cultures some of that can be even abused, like that well, it is abuse. Not just in Western cultures that we see the spanking and all of this stuff is added with a lot of these collective cultures. And I think it's important to note that the fact that it's just we don't have, if you say go to your room, there might be five people in the room playing. There is no go to your room. There is just we spank you and you kind of, there is no take away toys. Well, I play outside, so what do you mean? So that's the layers of where those harsh punishments come from.
Mm.
In those sort of communities is um how I look at it. But with that authoritarian style, what I do see is it tends to deviates a bit, or they get lesser as the kids grow up. Your mom is not calling, well, I don't know, but most moms are not calling you in those same style saying, did you become this? Did you do this? The rules are still not sort of rigid in as you grow up. They in fact get lessened. They now, and that's the difference, right, between when you think of the narc and the extension of me, it doesn't continue through that. So that's I talk about that even more in depth, and then in the book, but um it doesn't follow you throughout sort of adulthood. And I think that's the main way of sort of differentiating it. But then also, um, because I've had to figure it out myself, but also in these cultures, those punishment, how are you being punished? Are you left a plate in in the sink and you're being burnt, or you're being hit in the face? Like it's, you've seen extreme harsh punishment, the comparison of you're not good enough, or this is the constant um belittling of the individual, which I know there's a spectrum with all of that, but those true hard narcs, they don't, they use that culture as a sort of a source of getting more and more of that. So you put a narcissist in that kind of cultures, like in these, it can be really detrimental for a lot of these clients of mine. It's yeah, because again, if you're whooped, it's okay. They don't ask,
Mhm.
did they use a belt and a bottle, or it's once a child says, oh, once a child hears it's okay and your parent is right, you just kind of quiet this, and not even you don't want to open up to that adult anymore. Um
It's interesting. I like even with Asian clients,
mhm,
especially when me growing up in the US, but I will have clients who are from East Asia, and especially in narcissism, we always, talk about like, oh, the narcissistic parents want you to be successful, and they just want you to be on top and just achieve. And if you don't reach that success, they're super disappointed in you. They stop loving you. It's very conditional. But if you talk to some of my Asian clients, or even how I was raised, it's like they go, yeah, of course. It's normal for your parents to want you to be the best and get straight A's and be a perfect violin player. And if you're not, of course you're not as worthy. And of course
Yeah.
your parents won't love you as much. And I'm like, okay. Is then the whole
Oh,
cultural belief narcissistic, or we just
yeah,
believe in like loving your child no matter what, and that's
yeah,
not how it is? Like, how do
yeah.
you deal with like that, what you said about if they don't achieve or they don't meet
Yeah.
those standards, they're
Well,
loved still?
you see, I've seen client, you bring that up. I had a client as um uh, from Asia as well that was sort of dealing with the same Vietnam. Yeah, I think that was it. It was sort of dealing with this, the thing with us too, when you grew up with a narc, it's almost as though we there is this perfectionism that and that's the hard thing is the stuff that they implement in us. It kind of works. There's this forcefulness of you have to do so, and you're constantly proving love, right? Like there is this so it you are you don't stop your education. You keep going and you keep going, and it never feels like it's ever enough. Right. But then the thing is you don't really get that sort of love like the other if it in fact never stops. If there is you're saying the wheel keeps going on and going on and going on. The difference there is in the other home that you described, you hit that accomplishment. You're now a doctor. You're loved. You're praised. You got everything. The other one, you could be a doctor. Heck, you could be a doctor, you could be an astronaut, you could be all the degrees, and you still did not hit that,
Yeah.
right?
Yeah.
So it's never enough.
Mm.
Can
Yeah.
you speak to, so I feel like I have a cluster of questions around this point, but it sounds like something happened when you moved to the United States
Mm-hmm.
where the abuse actually intensified. So, kind of the first part of my question is, was there something, I know you had said like now you're in the United States, you're expected to succeed. So it sounds
Mm-hmm.
like that was part of
That's
it.
the community
Okay.
part too.
Agreed.
I
Okay.
think the community because you left you feel like the lucky one in so
Mm-hmm.
many things. Like you're lucky. So
Okay. So,
how can you have a problem? That's the only thing you have is your parent was hash. Okay.
yeah.
Like you're in America. Be grateful.
Okay. So there's this immediate expectation of like, you're not going to waste this opportunity. You're lucky you have no excuse now.
Yeah. Yeah.
Um, did your did your narc pick was that the behavior that they kind of intensified?
Oh my gosh, I brought you to America. That was
I
all I
see.
heard going on.
I see.
Like,
Okay.
I brought you to America. So there is this huge payback too.
Okay.
Like yeah, I brought you here. I was meant to do all kinds of things because they brought me here.
Yeah. It's
Yeah.
interesting. I feel like I've heard from so many like stand-up comedian acts when they have immigrant parents, they'll make that point. Like, I'm such a disappointment. I'm a stand-up comedian when my parents were immigrants here. So that was just
Oh.
I I was wondering if you could it's it must be an interesting experience to come from such a different culture and then be placed in American culture, which is
Mm-hmm.
so individualistic and specific. And now you're
Mm-hmm.
dealing with a dual cultural reality.
Mm-hmm.
Can you
Mm-hmm.
kind of speak to what that's like for you and what you've experienced from your patients?
I think for me personally, I love it because I get to pick and choose what I want to accept in my home and what is
Yeah.
not okay, how I raise my kids. I think, I'm also exposed with more education in the way of emotional intelligence and all these other things that I'm not that they aren't, yeah, it's just in a different lens where I can see the mental health piece of, well, if people are beat, this is what happens. So you get to choose differently. And there is fortune. Yes, I am. I do consider myself, because of all of that. in fact lucky. Now, does being lucky mean that you don't cry at night and you don't suffer through different mental? Yes, you still do, right? Like, um, but I think for my clients, the thing is, with with the collective cultures and individualistics, there, since we're such a group, when one makes it, that means we all make it. So therefore we all also have this responsibility of what are you doing for us, the all. And that's also just how too it can feed a narcissist in that sort of form too, where it's like, well, listen, I watched you when you were 5 years old, a long time ago. You owe me $500 that you haven't sent. So sort of, oh, I did this one thing, like um so it it can feel like you constantly are working for a community. And so I've had to sort of embrace both to know, okay, this individualistic part is, it's okay to enjoy the fruit of your own labor, and it's okay to figure out how many people you want that fruit to go to, or maybe just you and your the humans in your life. So just, yeah, navigate that a little bit differently.
I'm curious if, when you're working with clients and you're thinking about yourself
Mhm.
and navigating people in your family with narcissism, do you, I want to say suggest because we don't suggest, but do you
Mhm.
do different kind of work with people who are in collectivist cultures versus like American individual cultures?
Yeah.
Because, maybe I'm so steeped into the Instagram world and it's all
Yeah.
about like, oh, do you have a toxic, narcissistic parent? Well, don't talk to them anymore.
Yeah,
Get them
let
out
me
of your
go back
life. And
to
I'm
work.
like, well, that's kind of
Work.
hard in these other cultures. Yeah. So,
Work.
I
We,
mean, even some clients I've had are really hesitant to even say or that their parent was abusive.
mhm.
Not to even mention what a personality disorder is. They'd be
Yeah.
like, "Oh, that's of course they're entitled. They're
Yeah,
my
that was.
mother. They're my father." So
Mhm.
what? How do
Mhm.
you work differently with uh, victims of narcissistic abuse from different cultures?
Yeah. No, it's great that you bring that up. That was me too when I was sitting on that couch when I was, 18, 19. Like, how dare you? I want to come across this and just like, fight you for this. Like this, because there is that protective culture. Like there's protection of our family, there's protection of our culture, there's pride in that. And in so many ways, it's a beautiful thing. Like, yes, just like Americans have patriot. Like we have we also love our culture, and it's where we came from, is where we are. Like there's a huge, like, honoring culture that is, it's just, it's part of us. So to say that that's wrong, it's so difficult, like to and then you also hear, okay, well, this person had it that way too. They experienced this, you know so I went to the home, and your mom was spanking them or doing this or doing that. But again, narcissists, it's when the doors are closed that you really see who they are. It's not, they might have been spanking them in a nice way when you were there. Um so no, how I really, with this culture, is I try my best to understand, like, I from their perspective. First of all, I think I get two type of clients that come in. One that already, like, yep, full on narcissist. This is the person that I experienced this with. They've read about it. They spend extensive amount. They're usually very educational and educated, and really and maybe they're already parents too, and they're like, this is, I just don't want this to happen to me. I'm now in a relationship with someone like this. How do I co-parent with them? All of these things. They've really seen it. They're starting to, like, whoa, this is happening. Um, and then there's another one that might come, another client that might take um so long. It could take weeks and weeks and weeks of trying to help them to really get there versus me naming it, but helping them name it because I know what that feels like when it's named from my lens, but helping them name it, and helping them get there to identify, because in so many ways it's so normalized for them that it feels like, yeah, and then it's often with I have to be perfect. I am the problem. And I'm dealing with depression and anxiety, and I walk around eggshells, right? Like there's all these layers. Um, so helping them understand, until you see what it is, it's gonna be really hard for us to get to that healing place because we're still walking in, and these are why this cultures is so hard because you can have for example, an Indian that is still living with several family members in the home. So, um, what do you say cut off? Cut off and go where? Like, like they can't. Um, well, set boundaries. There is no boundaries. They come in my room whenever. It's just like, yeah, what do I do? So, I think for folks when they start having that breakthrough is actually understanding, okay, well, see the pattern. Let's sit with mom and see what that feels like. Just for 15 minutes. Then let's sit with someone else and see what that feels like. And we just start to and all of a sudden they're like, "Oh, it feels different. Like she makes me anxious. She makes me, tense. So they're now starting to identify the signs without me saying anything, but they're starting to get there on their own. And then when it might be when I sit with a stranger, then I start to wonder, what are they thinking about? Well, probably because that's, yeah, comes from the narc, but they're like, what are they thinking about? Do they like me? Do they not like me? I'm like, oh, you're still doing uh gymnastics here in your head with someone else, but how does that person makes you feel externally versus what goes on in your head? Okay, much more calmer. Okay, those kinds of stuff. So we want to find ways that we can get more of that happy medium, like that space of happiness, and eventually you might get to that place where, okay, maybe I just needed this family to reach my goal of being whatever that goal is before I can get my own place. But I do know that this is not healthy for me. Again, without me having to do much, but just sort of leading them in that way. Yeah,
Yeah,
it's rough. Yeah.
this what you said about boundaries is exactly kind of what I'm facing with a patient who knows that she has a parent that's a narcissist.
Mhm.
But I think because of that parent's behavior and also the culture, like
Mhm.
she's in this position of being everybody's go-to person for help, everybody's in her business, everybody, has these expectations of her. She feels like she has to be everything for everybody else. And this is like something she wants out of. But without alienating herself from the family. And I guess I'm just wondering, like, how, once you've recognized, right, like, yes, there's a narcissist here, and yes, there are kind of cultural forces that almost expand or like compound that
Mhm.
the influence of the narcissist, like, how do you set boundaries within that structure?
Oh my goodness, this boundary stuff. It's such a hard situation. I tell you not. I mean, I kid you not, because even for me, I still struggle with it here and there. But I rethink my mental health. Like, is it worth those, but I think um for that client is to determine what are their goals, what are their long-term goals.
Mhm.
Do they still want to sit in that mud? It feels
Right.
so destructive. Like, are they okay with that? And if they're okay with that, then just sort of help them through it. Like, it might just be that we do some deep breathing and we work through the anxiety and we take breaks and then we walk outside and then we come back in and then we distract ourselves with cooking for the family or um, get occupied with other things in the home that doesn't make us feel so um, anxious or depressed or whatnot. but they have to be the one to choose that. We can't choose it for them. I mean, as much as we hate to see them go through it, but we don't want to choose it for them. And if it is, I don't really like this. I kind of want to go, and I don't know where to start. Okay, what seems feasible for you? Like where do we start?
Yeah, I mean, this reminds me a lot of work with East Asian clients and other kind of clients where even we're talking to them about their values or their
Mhm,
career desires, right? And then you go, what do you want for your life?
mhm,
What do you value? And the way we want to do it with our individualistic clients from America, it's like, what do you want as an individual?
mhm,
You know, besides
mhm,
what your parents want or society
mhm.
wants, what do you really want? But with these clients who are
Yeah,
from other cultures, they go, I just want my parents to be
love
happy.
me. Yeah, yeah.
I want them to, I just want to, I will be a doctor because that's what makes them happy.
Yes.
So it's like,
Yep.
what do you want? Oh, I want to make them happy.
Yep.
So what do you do when you have those clients who they're what they want is to make their parents happy, and yet their parents have a mental illness or personality disorder that makes them never happy?
I mean, I can tell you it took me what over decades to I mean a decade to like it until they reached that point of this is you still talking to someone that has had a master's that went through all the things that that still wasn't enough. A professor, a therapist, they couldn't tell me nothing. You couldn't do anything that could have prepared me to what leave, no, or do whatever. No, I was not in that mindset. I was not ready for that. I did not want that. Um, I think for me, what trumped all of that was my kids. I think for your whomever these, when you're helping it, sometimes we don't do it for ourselves, but we have to, if they have someone else, so just sort of like the addict, like maybe it's their child they do it for. Maybe it's their, they're doing it for some, because I could have probably stayed in that mod, as I say, for so long. Um, and maybe be okay with that because whatever, even though the mod was literally destroying me, and in fact who knows if I would still be here, but that's how terrible, like how hard it is to leave groups and those cultural expectations. So I empathize with my clients in a way, like if I couldn't be ballsy enough after having, knowing all of these things, understanding that, and I still want it to be so much, you know, I still wanted love in whatever form it looked like, even if it looked like control, even if it looked like, all of these different things, then how do we just think we're not God. You just don't sit in a couch and all of a sudden think that person will get there immediately. It might take a while. But I think again, it's sort of like that. What do they do? The ice cream thing where you like lick and you're like, oh, it feels good. Is hold on to this and that feeling of good. That was basically what I do with the sit with someone else and see what that feels like. Eventually, when you start to want good things, you're going to, you know, you start to feel seen, have, be heard. All of those things start to come. Maybe it's building those different communities, what that looks like, finding a community still within your community that still gets it, right? Um, and I think for us, sometimes we forget that there's still people in these communities that can relate to us in this way. So finding that and I think can go a long way as well. If you're not ready, I think I lost your questions there somehow, but I hope I answered it. Did I?
Can I ask where you've ended up with this? Have you cut off the relationship or do you just approach it in a different
Um,
way?
well, for me, I'm there whenever they need me. but
Mhm.
I let it where they need me. I don't go seeking. I think before I was seeking it so much. So, and that just, I think that gives them more control in my brain. I don't know, like it probably, but where, when I say I'm there whenever they need me is if, if they all of a sudden called me and said they needed help, which oftentimes doesn't happen, thankfully. Um, but yeah, I lead with that, and and I don't know, it's not for them being a um a vulnerable narcissist. It is really hard for them to hear me as a therapist. I think that's also hard because there are ways that I talk, and maybe it's almost sort of triggering in a way. So they don't want to hear all of that. Like, um, and I don't let them. I can say, okay, might have a 2 minutes conversation, not a 1 hour conversation about, oh my gosh, this, or just all the terrible things that has happened to their life that never changes. um and yeah, I might not sit for that and dwell with, because part of me would want to fix it, or how do I help, because that's what we want to do, want to help. Hmm.
How how did becoming a mother change your relationship to this? Like, how do you think about this in your parenting
Hmm.
or the way you were raised? Yeah, how
Yeah.
did becoming a mom influence your
Well,
thinking?
I think, when you say that, I, oh my gosh, I had, and yeah, I'm gonna try not to be emotional here, because,
We love
but
emotion.
I had my little human, and for the first time, I understood what love. Like, I had my partner, and I were happily married for over a decade, the love of my life. But I really, truly, it just it felt easy. Like, it felt easy, and they didn't have to do anything other than exist. Like, really, it was just easy. Um, and I don't expect them to ever do anything other than really exist and live the life they're supposed to, or whatever that means for them, while I guide them through this whatever life. Um, but it felt easy. And I remember um needing my narc when I just had a baby, and I said, "Well, I never asked you for anything. Can you do this one thing for me? Just watch him for a day." I said, "Oh no."
Mm.
And that's when I also realized that the love I have for I could never, that yeah. So when I say mine is like pretty high up there. Pretty. So yeah, they weren't able to do it. They couldn't sacrifice a day.
Hmm.
Yeah, yeah, yeah. But just wow.
Kibby, I feel like that's when you had a turning point too, is when you had a son. So,
Mm-hmm.
Yeah, I mean, we could tolerate so much abuse, I guess, for us sometimes, or just like take it in. And
Mm-hmm.
then when you see it either towards you or towards the kid, and
Yeah.
like you just have a new perspective when
Mm-hmm.
you step back and go, oh, I used to be that kid and I got this kind of treatment. Or how could someone look at me at that
Mm-hmm.
age and do all the things that I experienced, right? It just changes your perspective in this interesting ways, and it just
Yeah.
makes some things a little bit clearer of like,
Yes.
wow, you
Yeah.
treat a kid like that? Like,
Yeah.
I would
Yep.
never do that to my son.
Yep.
Or
Yep. Yeah, the same as me. I thought, to me, I almost looked at it in a different way, for them to be able to um sort of learn how to parent again, which is such an odd thing to think of, right? I'm gonna give you this chance. It'll be my
Mhm.
sacrifice.
Yeah, yeah,
to do it right this time.
yeah.
Well, did they fail so big? Like it
Yeah.
was like, yeah, yeah. And I kept trying. I kept trying everything I could. But
Mm.
they weren't able. They just didn't care. I don't think it just, my kiddo would cry and they would bring out a camera to record them. They didn't do something about it. Yeah. It just, yeah. To laugh about it later or laugh about it during the recording.
Oh my God.
Yeah, I know.
It's intense.
It is intense. It is. It is. Yeah. So, yeah, being a
Well,
mom.
I'm glad you've, I mean, it sounds like you have figured out how to set some boundaries,
Yeah.
um, and kind of been able to say to yourself, like, I will communicate to the extent that it aligns with my values,
Mm-hmm.
and that's it. No
Mm-hmm.
further.
I think embracing both cultures helped me a lot. And then I think also my partner, like, and I also got to experience what having a healthy parent was like through his in that
Mm.
just that little way. Like, oh wow, people make sacrifice. You do this, you just show up and just love him and care for him. Oh wow, this is no wonder he's such a well put together human being. Yeah, this is nice. So it's not so cultural. Human beings can actually, my husband is Nigerian American as well. Um, but has a very loving parent. Just, both his mom and dad passed now, is just really just amazing, truly is. Um, so seeing parenting in that sort of lens, sometimes you just don't get to see when you are in a relationship or grew up with an arc, you just don't get to see what healthiness looks like. Um, and understanding that culture can still exist, and we don't need to accept that unhealthy part. We could still love our culture. We can still embrace it 100% without accepting that abuse that we don't have to. So I think he helped me a lot, and also it was affecting our relationships. Like this, you know, he also wants to fix things. Like, we can't fix this person, um, and it's hurting you, and it hurt him to peel me off the floor. So
Mm.
yeah, so yeah, it's like this is not okay. Yeah.
Well, it's awesome to see someone who's survived this and like learn to thrive through it and really kind of get a handle on it and their own sense of wellness and boundaries and be able to help others.
Yeah.
'Cause it sounds like you went through a hell of a time for a lot of years.
Whew. Yeah. Yep. That's why I chose the profession. What we all do. We want to help others too, in however way possible, not to feel the same pain we've had to endure and feel. That's not okay. Yeah.
Well, I don't have any more questions. Kibby, do you?
No, I think this has been great. I'd love to hear more about your book and how people can find your work
Yeah.
and
Well, my book, thank you, Dr. Kippy, for asking, but my book is on Amazon, and everywhere books are sold online. And really it just dives into exactly what we talked about, but even more in depth of you know, in these cultures, how do you distinguish and really truly know a narcissist? And if you do have a narcissist, how can you get through it and the other side and or live with them, so to speak? How do and also helping therapists understand that, especially the ones in Western lands. Yeah, help people in collective cultures that are going through this experiences. So yeah, you can get the book anywhere books are sold online, and reach me through my website, beautifulsunshinetherapy.com. facebook.com. That's where I'm at. The name of my site is Beautiful Sunshine Therapy, and I have an
Love-
Instagram page too. Yeah.
Amazing. Well,
We'll
thank
link
you
all of
so
those in the show notes. So
Yeah.
Okay.
Thank you so much for this has been such a fascinating talk and
Thank
topic.
you.
So really grateful to have had you on.
Yeah.
And yeah.
Thank you
Super
guys.
nice to meet you.
Appreciate it.
thank
And little
you.
helpers, if you loved our conversation, give us a 5-star rating on Spotify and Apple Podcasts, and we'll see you next week. By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval or endorsement.